this was an important topic because the word depression is so commonly used now. Everybody just says, "Well, I feel really depressed."
I was going to say, and misused,
yes.
really. So
exactly. So we'd like to talk about the true clinical definition of depression, which is really more severe than just a sadness or the blues or down in the dumps. Depression is a low mood, which means lack of motivation, an inability, hopelessness, inability to find pleasure in everyday activities or things that you used to enjoy doing, which these symptoms would last most of the day, nearly every day, for at least 2 weeks. And depression in your students might look like a lack of interest in others, a lack of interest in things that are typically fun,
like PE.
Yes, PE, electives, recess. These students are going to have difficulty concentrating and making decisions. Their minds are going to be elsewhere. They will be irritable. They can go into that cranky mood pretty quickly. These students might withdraw and isolate and just lack connection with others. They could have difficulty sleeping, so they will appear very tired in the classroom, maybe even trying to sleep at school. Low energy, fatigue very easily and quickly, like it doesn't take much. And then any change in appetite, it can be either overeating or lack of eating. And with kids with their 7s, 8s, and 9s, if they're not hitting those average and typical growth milestones, that can sometimes be indicative of depression. And like Kelly said, with hopelessness, any other feelings or expressions of worthlessness, helplessness, and extreme guilt that is very unrealistic, that almost appears delusional because it's just nonsensical. That is what true depression looks like. And we really need to be on the lookout for this in our students, because thoughts of hopelessness and poor self-esteem and that sort of thing, this type of depression can lead to self-harm and thoughts of suicide. And so Kelly, I was hoping that you could tell us a little bit more about those risk factors that we need to be aware of in our students.
One thing I think that we need to remember is that depression, the students our age, I think it's kind of an early onset for that. I think that we are more likely to see students who are experiencing a life event that is causing them sadness, but aren't experiencing true clinical depression. That probably doesn't show up more until the teen years. So
it's a very small percentage of our students, like in the single digits.
Yeah. So a lot of times, maybe at our age, we see things that maybe kind of look like the irritability and it might look a little more like ADHD or anxiety, and then as they get older, we find out that maybe the true, more accurate diagnosis was depression. But I think that, one of the things, I'm sorry, I have a nose itch. One of the things that I think was our goal for these videos also was to talk to you about things that you might even be seeing at home or with your, nieces, nephews, other children. So I do want to talk a little bit about self-harm and suicidal ideation, because we don't consider the two to be the same. So we do have students who, not necessarily students who are cutting and doing the types of things that lead we see a little more of that in the junior high age, but some of them are headbanging, or they're doing behaviors, they're hitting themselves, kind of that early self-harm, and that definitely is something that you want to bring to our attention if you see that. We also want to make sure that we are addressing it, because it could be a sign of a bigger issue. Well, it probably is a sign of a bigger issue that's going on at home or somewhere else in their lives that needs to be addressed.
Would you say that if students at this age are engaging in any self-injurious behaviors that are a little more serious, such as any they've seen somewhere else that they might be.
Yes. Thank you for saying that, because before we started recording, Jill and I were talking about the things, the videos that our students are watching on YouTube and other avenues, and also the video games that they're playing. Some of them are very suggestive of self-harm. Some of them actually mimic, like through video, the idea of self-harm. We've even heard in the news that there's videos where they encourage self-harm to children. So that's definitely something that we need to be aware of as we are questioning what's going on, like where they might have seen something like that or heard something like that, because definitely that is something they could have, or even from an older sibling or older cousins or something like that. It doesn't even have to necessarily be something they saw in a video. All right, so now let's talk a little bit about suicidal ideation, because that is something that we hear students say things like, I just want to die, or I don't want to be here anymore, and anytime that happens, we want to know. I think you probably know that it's something that is reported to us, I think automatically anyway, so definitely it's something we want to know. When we assess a student for what we call lethality, we're looking to find out if they really are serious when they say that. We actually ask them something like, do you want to kill yourself, or what happens if you, it depends on what they've said, but we are very direct in our questioning. So if this is happening to you at home and you are, have a child, or your child's best friend is saying this, don't be afraid to be very direct in your questioning about what their thoughts are. If I have a child who tells me, that they are serious, I will ask them, well, how do you think you would do it? Because in that question, I'm assessing for means. Do they have the means to carry that out? Do they have a plan? Because if they have those things, they're pretty serious, and further action needs to be taken.
I think that, hearing a question like, are you thinking about hurting yourself or someone else, being put in the position of asking that question might seem very uncomfortable, especially if you've never done it before. But when you think about it, you really could be that person that is saving a life, and so it is absolutely necessary, and you're not introducing anything into the child's, mind or thought.
No, when we are taught how to assess these situations, they teach us to be very direct in our questioning. So it's not something that we're telling you that's far-fetched. Mm-hmm. It's definitely legitimate. And if you have a situation where you feel a child, well, really, to be honest, no matter whether I think a child is serious or not, I always call the parent. And how serious I think they are depends on how the conversation will go with the parent. I might tell the parent, I really don't think they're serious, but this is what they said. Or I might say something totally different. I might say I'm very concerned about Jill, because she said this to me today, and there's information that we can send home with students. There have been times that I've even had a parent come and pick the student up because the student was not going to be allowed to be alone. So certainly it is something we want to take seriously. Unfortunately, it's becoming more and more common, even in the younger ages. So it's definitely, they don't understand the seriousness of the actions they may take, or the finality of the action that they may take.
That